and welcome to this week's COVID-19 Live Town Hall, focused on your health and safely reopening our economy. My name is Erica, your moderator on the call. There's a lot happening again this week, and we know you have so many questions. Your Douglas County Commissioners, Roger Partridge, Laura Thomas, they are live and ready to take your questions. Also joining on the phone to answer your questions are Dr. John Douglas and Melissa Sager from the Tri-County Health Department. We also have a special guest on the phone tonight who's actually joining us now, Douglas County School District Board President, David Ray. Press star 3 on your phone keypad at any time to ask a question. We know that there are lots of questions, and we want to get to those very soon. Again, that's star 3 if you'd like to ask a question. But first, we're going to hear from updates from Dr. John Douglas and Commissioner Partridge. They'd like to share a programming note for tonight. So, Commissioner Partridge, go ahead.
Thank you, Erica, and good afternoon, everyone, to our listening audience, online audience. Thank you for joining us again for, I believe, our 12th Town Hall, which we want to be able to be in touch with you. So joining us this evening, certainly Dr. David Ray, Dr. Douglas, and Melissa Sager from Tri-County Health, and also Commissioner Thomas. We will not have Commissioner Layden on the call this evening. He regrets not being able to. He unfortunately had a non-contact sport contact injury over the weekend. So he had to have a few medical procedures. So we put him on injury reserve. He is still doing county business, but he will not be able to join us this evening. So we just think of Commissioner Layden. And so please send him good, warm thoughts and prayers for his good healing.
Thank you, Commissioner, and I know everyone else wishes him well. Now, Dr. John Douglas will share the most recent Douglas County COVID-19 public health data, the good news that creates the conditions for Douglas County to continue moving forward toward reopening our economy. And as we get started, we will show 2 slides for our online viewers. The first illustrates COVID cases by county, and the other is hospitalizations by county. So, Dr. Douglas, go ahead.
Thanks, Erica. Very nice to be with everybody this evening, even though we missed Commissioner Layden. I don't know whether you can actually see these 2 slides Erica referred to, but they basically are both good news slides for Douglas County. And frankly, they are good news slides for the 3 counties that we work with, as well as Colorado. What you'll see on the first slide is that Douglas County has had far fewer cases than our other 2 counties. It is slightly smaller in population, but frankly, the rates, when you adjust it for per 100,000 population is the usual way we do it, they've always been low in Douglas County, and they've continued to decline. And I would notice that that's in spite of the fact that Douglas County, like other counties, has had increased testing capacity, more folks with the ability to get tested, and yet not seeing more cases is really fantastically good news. The other graphic that Erica referred to is hospitalizations. And here you see basically total hospitalizations. Blue shows the number of folks that got hospitalized not in an ICU. And orange, looking more serious, is in fact an ICU admission. About a quarter of the 200 some odd cases from Douglas County did require ICU admissions. What you don't see here is the trend line, which really looks even more impressive than the case trend line. It's going down even faster. It's staying down even farther. I take those 2 things together as being incredibly important for the work that Douglas County has been doing to suppress the infection. It was notable today, I think, that a national publication, something called Politico, covered what's happening in Colorado, what's Colorado getting right about reopening. And it talked about both the compliance or the cooperation of our citizens, the leadership of our elected officials, as well as a number of public health strategies. And I really do think that Douglas County has really been a leader in this area. So it's terrific that we are already seeing the ability to reap those rewards from that with more and more aspects of the county opening up. There are going to be a couple of new developments over the next 1 to 10 days or so. New development number one is that the public health order, Safer at Home, that we've been living under, will have some new parameters of relaxation added to it. We expect to see this maybe as soon as tomorrow, where residential summer camps will be allowed to open with certain parameters. Indoor events such as conferences, receptions, museums can begin to open. Outdoor events, including fairs and rodeos. I know Douglas County's been really interested in this, and we'll see what the final language from the state looks like, but at least it's recognized that that's going to be important to be added to statewide. There'll be some other issues such as estheticians who do facials have had a problem with their clients having to wear masks. It looks like that's going to change, as well as other things, beard trimming, lip waxing, etc. Again, not things that are perhaps as important as the schools. We're pleased to have David Ray here this evening, but certainly I think things the citizens have been interested in. I do want to say that we'll proceed with all these things with a lot of caution, continuing to watch the measurements, continuing to improve our testing, and from Tri-County's perspective, continuing to grow our ability to do case investigation and contact notification, as well as our ability to educate the public about things like face masks. The other thing that's going to be happening in the next 10 days or so is a new framing of public health in Colorado with the most relaxed portion of our life before we get back to total normal, which is being called Protect Our Neighbor. We expect to see more information about that, but it's basically going to be taking the approach that pretty much everything in the community except for mass events can be allowed to open up with certain parameters. That's all contingent on having adequate transmission metrics, adequate healthcare capacity in our hospitals, and adequate public health capacity. But I really think that the question many have been asking, which is what is going to happen, this is really murky, is beginning to be more and more clarified. So great metrics in Douglas County, and I think good news as we continue our cautious reopening. Thank you.
Thank you, Dr. Douglas. And to all of you that are just now joining this call, if you would like to ask a question, you can press *3 on your telephone keypad, and that will get you into the queue, and you can ask your question live. And now let's get started with a question that we've been asked recently for our special guest from the Douglas County Board of Education, President David Ray. Mr. Ray, now that the requested variance for graduations has been approved, can you share more details about what those ceremonies will look like and how your team has planned for those? Go ahead.
Thanks, Erica, for the question. And I will just also preface this by also thanking our commissioners, our Tri-County Health, Dr. Douglas, Ms. Sager, for all your support in helping us submit the variance that will allow us to really honor our 2020 graduates in a as much of a traditional ceremony as we can possibly do during these unsettled times. So I'm truly grateful for that. There certainly are some standard practices that we're going to make sure are enforced with all our graduations to make sure they're compliant with those. But I also would tell you that we have a long history of all of our schools having autonomy for what that ceremony might look like. So even though I share with you some of the things that are standard for all our ceremonies, just know that there may be some tweaks depending on the size of the graduation class and depending on what their preferences are in terms of speakers and music performances, et cetera. But basically, we will be hosting 14 graduation ceremonies, including 2 of our charter school high schools, as well as our 3 alternative schools during the week of June 20th through the 27th. And I'll tell you, our staff are amazing in that this is going to be a fine-tuned machine because we're sharing Echo Park Stadium for all these graduations because we want to stage that stadium according to the things that are allowed for us to do in the variance. But we have several graduations back to back each day of that week, so it's going to take somewhat of an army of people to really ensure that we're compliant with some of the safety standards that we know we need to ensure. So basically, what you'll see in graduations, we will have seniors staggered in terms of when they arrive at the stadium. They will enter with their two guests. The seniors will sit on the field, social distanced apart. Sometimes we refer to that as the Air Force Academy model that we saw our cadets do a month or two ago. Um, Parents or the guest will then sit in the stadium, and again, we've staged that stadium so that we are ensuring the necessary social distancing between households. Um, we also then will, like typical ceremonies, we will certainly then at that time acknowledge each senior who will be able to walk across the stage. There will be a small group of dignitaries standing apart, of course, and with face coverings. But we will acknowledge them. The seniors will self pick up their diploma off of a table on the stage and then return back to their seats. And then the dismissal will be similar to how we did the arrival, where that will be staggered as well to ensure not only good solid traffic flow, but also just making sure that we're adhering to those social distancing requirements. So I think that is the overview, and I know there may be some other specific questions out there. So I will pause for a moment, Erica, and then ask if there's some specific questions regarding how graduations will look.
Okay, great. Thank you, Mr. Ray. And also, we have a lot of new people joining our call, so I just want to mention to them, if you would like to ask a question live on this call, just press *3 on your phone to get into the queue. Okay, so Mr. Ray, we do have an online question coming in for you, and it reads, could Mr. Ray share more about the process the school district is using to decide what school will look like next year?
You bet. So basically what we did about a month ago is we launched a task force of community members. And on that task force, it included teachers, parents, students, district leaders, our classified employees, medical professionals, business leaders, and other community leaders and members as well. That task force actually is a 2,000 member task force. And so what we've done, and that's the number of people that really wanted to have a voice in helping us develop some plans for what that reentry looks like. Within that task force, then we have about 200 people that we actually assign to a specific focus group. And we have about 14 different focus groups that include things like developing the contingency reentry plans, looking at online learning, looking at staggered entries, mental health, special education, other special needs populations, nutrition services, transportation, et cetera. So 200 of those people have been working for the last several weeks on helping create some recommendations based on their research, based on us also looking at all the different guidelines that we are to adhere to. Certainly we look at CDC and we look at Colorado Department of Education and the anticipation of the governor's orders, and of course Tri-County Health, to help us begin to formulate some plans of what the entry will look like. Certainly we are going with the notion that we will open school in the fall, and it will open just as normal as possible, pending those agencies that will be guiding us in terms of restrictions and or safety mechanisms that need to be put in place. Those, going back to the task force though, so our next board meeting on Tuesday night, the task force will present to us their recommendations and contingency plans. And contingency plans can be anything from 100% online learning like we had to do from the month of March through the end of the school year. It can be looking at an A-B schedule where we stagger our students, where students attend school for 2 days and are doing remote learning for the remaining days. It can be, something that looks like elementary students being different in terms of knowing that we can control some of the safety restrictions more in an elementary setting than in a secondary setting. So we might have elementary students back 5 days a week and use a staggered schedule for high school. But all of that, again, is pending, again, the recommendations that we get from our health professionals and the agencies that actually help govern the educational system. So those scenarios we'll hear more details about next Tuesday, and then the board will approve those recommendations that are presented, or at least provide feedback in terms of whether or not we need to continue to gather more information to solidify what those recommendations have looked like. So that, in a nutshell, is how we're looking in terms of the reentry. And I would just again invite anyone that wants to tune in to our board meeting on Tuesday, next Tuesday, June 23rd at 4 o'clock. Those are live streamed, and you can hear firsthand the recommendations that we are receiving as a board.
Thank you so much for being with us tonight, Mr. Ray, and we appreciate you taking the time to share all of those details. If you're just joining and you would like to ask Mr. Ray a question, or anyone else on our panel this evening, just press *3 on your telephone keypad and you can get your question into the queue. All right, let's go to our first live caller. We have Robin in Parker for Dr. Douglas. And Robin, you are live. Go ahead and ask your question.
Hi, good evening. My biggest worry and concern is that nobody is enforcing the masks, and I have 2 medical issues that I have to protect myself from. So I wear a mask everywhere. When I'm grocery shopping, I have to avoid people who have chosen not to wear one, and I want to know why the county has not supported those of us who are trying to stay healthy and well. I also have an upcoming surgery. I have to be careful for that. And I've tested negative because I had prior surgery in May, so I had to be tested. I tested negative, no antibodies, no nothing, because I've been at home being careful. And I want to know why our county's not supporting us all and staying safe.
Robin, thanks for the question. It's a timely and important one. I will say that Tri-County is a strong believer in the use of face coverings or masks. We think it is inconvenient, it's new, it's odd, but it's something we really need to get used to, because especially in places where we can't do social distancing, it remains one of the best tools we've got for preventing transmission. Now, you mentioned that you wear masks yourself, which I think is a good idea. I do the same. And I'm doing it in part to protect myself, but I'm also doing it because, frankly, transmission prevention is the greatest attribute of masks, which gets down to your real point, which is, why is everybody not doing it? And this is, in fact, a frustration. Tri-County has been working hard with the communication partners in each of our 3 county governments, as well as our local health departments, to message and promote and educate the public about the use of masks. Now, we have considered what I think you really allude to there, which is a mandate requiring masking. We got initial feedback from many in the community that there would be potentially greater opportunities to get masks actually to be worn without a mandate. There was, frankly, to be honest, some perception that some folks might defiantly choose not to wear masks if the public health order said you had to do so. So we are watching this with great interest because we do believe it's important. I feel particularly concerned about people like you that have got underlying health conditions, because you are at greater risk. And please know that we are watching the situation with great interest and concern. We're actually doing monitoring on a spot basis for large stores across our 3 counties. Douglas County is actually looking pretty good by that spot checking, pretty good being about 75%. I wish it was better, and hopefully it will get better with our education. But I think that for all of us in positions of leadership in the community, voicing the importance of that is important. So thank you for that reminder.
Great. Thank you, Dr. Douglas. And again, if you're just joining us, *3, that's *3 on your telephone keypad if you would like to ask a question. Next, let's go to a live caller. We have Desi, and they have a question for Commissioner Thomas. Desi, you are live. Go ahead and ask your question.
Good evening, and thank you very much for taking my call, and thanks for all that you were doing. Last week on our call, there was a discussion about variances that were being submitted specifically to events and gatherings and pools, and the amount of people being able to attend or be at a pool setting. Have those variances been approved? And if so, what are those numbers going to turn out to be? Thank you very much.
Desi, this is Commissioner Thomas. Thank you for that question. Right now, the governor's order for safer at home and the vast great outdoors does allow for pools to be open for 50% of occupancy, up to 50 people. And the commissioners are working on a variance to increase that number of people at a pool. But right now, that has not yet been approved. But you absolutely can have 50% of occupancy, up to 50 people in a pool. Thank you.
Great, thank you. And kind of along the same lines, Commissioner Thomas, we have an online question from Darren, and he wanted to ask you, what is the update regarding event venues and large gatherings? We're getting a lot of questions about that again.
Darren, thank you for that question. Yes, we do have a lot of people because it's summertime and there's a lot of weddings and other events that are planned. And we have submitted a variance that was a week ago. It was approved by Tri-County Health, and we are anxiously awaiting the state health department to approve that variance. That variance basically goes up to 175 people inside a venue, 250 people on an outside venue. And those requests include things like social distancing, making sure people are keeping their hands clean, washing off tabletops. There's no unmanned buffet lines. So there's a lot of practical things that have been put in place so that we can keep everybody safe, but still be able to enjoy great big gatherings with all of our friends and neighbors. Thank you, Darren.
All right, thank you, Commissioner. Next, we have another live caller. This is Karen, and her question is for Dr. Douglas. Go ahead, Karen. Karen, are you there? All right, we do not have her on the line, but her question is, she wants to know, Dr. Douglas, how can she see these graphs that we were talking about earlier online?
Thanks for the question, Karen. These graphs are posted on our website, tchd.org. And if you'll search for COVID cases, you can get to the part of the website that shows our data. I will notice that we've got a little bit of a Band-Aid on our website right now. You won't see the exact graph that was portrayed because we're transitioning to what we hope was going to be a more robust data system as we do more contact tracing, and we're having to kind of patch it. But you'll see a reasonable facsimile, and then by early next week we'll have the more robust data back online.
Great, thank you so much, Dr. Douglas. And we have an online question coming in from Amy, and she would like to ask you, if appropriate, can someone comment on whether airlines require flyers to report COVID cases post-flight to do contact tracing? And if I fly wearing a mask, should I self-quarantine upon returning to Douglas County?
Eric, would you like me to try that one?
Yes, please.
Sure. There are no state requirements for airlines to do what you just suggested, which I think is to let people know later if someone was on a flight. The Centers for Disease Control does have jurisdiction over contacts that happen during interstate air transportation. And I am relatively sure, although I'm going to have to double check that, that they do so for COVID as well as other infectious diseases. Sometimes, as you can imagine, it might be a little difficult to contact people, but we think that can be a very useful enterprise, given the fact that, of course, people on planes may be from or going to different destinations. Let's see, I'm sorry, the second question was, I think this, Erica, did you remember that?
Yes, the second question was, she was asking if she does fly wearing a mask, does she still have to self-quarantine after she returns to Douglas County?
Oh, I see. Okay, fair enough. You do not have to self-quarantine following your trip when you return to Douglas County unless you were in contact with someone when you were there. Now, if you know that you were in contact with someone when you were there, you actually shouldn't get on the airplane. You should wait until your quarantine period is over. And that's actually potentially one of the inconveniences of traveling right now. If you go and visit a family member and are told, whoops, the person's infected, you need to be quarantined, that could delay your trip. But the only reason you would need to be quarantined when you got home is if you got that kind of news, your sister calls you and says, I just found out I'm infected, then you would need to be quarantined. But from general purpose, you would not need that situation.
Wonderful. Thank you, Dr. Douglas. Let's go to another online question. This one is for Commissioner Partridge. It reads, I know you said last week that we will definitely not be canceling the Douglas County Fair and Rodeo, but can you tell us more about some of the changes that are being considered? Commissioner Partridge, go ahead.
Thank you, Erica. So this has been pretty consistent because we are still under the Safer at Home and the Vast Great Outdoors, which does give some limitations. So we are directing our fair board to plan for what we're calling a throwback fair with some degree of higher technology. But we will have fair. We will really recognize the 4-H and FFA members. That'll be one of the first priorities, to make sure the shows will go on for the kids with their animals and that we will have a sale. Another priority is to have the hometown rodeo, and we are able to do that now with the numbers, even though it's kind of scant. But we're hoping with this new order coming out, that'll give us some flexibility to increase those numbers of the fair. So rodeos will go on, even the planning for the bull riding on the Thursday night of the fair. And then the rodeos would be the Saturday and Sunday. So, and then the 4-H sale would be that Friday night. So what will probably be held back, what we do know we held back, is anything going on, we call it the marketplace, the commercial booths inside the event center, the open classes, which would have been the quilts, some of the baking contests and baking events, and plants that you would see. So we're trying to get more and more added back, but there will be some limitations. But please know that the fair will go on, and as we get closer to, we're hoping early July, we will have great details on our website to really give more explicit detail of what we would be allowed. But we are working on the variants with the Tri-County and CDPHE so that we will be able to expand that, because certainly, as Dr. Douglas has mentioned, the numbers in Douglas County look very good. And it's one thing we pay attention to is, no doubt we're going to see some more positive results, but out of the total tests being done, it's very few. And then we look at the severity from hospitalization. So numbers are good. So we feel we have a good case to be able to introduce a lot of activities. And I've heard the governor say rodeos are allowed. So our pitch to the governor and CDPHE will be, if you're going to let us do a rodeo, you got to allow us to be able to make it an event for the public to come see. Thank you.
Wonderful. Thank you, Commissioner. And next, let's go to our poll. And you can answer on your telephone keypad. The question is, have you participated on previous Douglas County live town hall events? Press 1 if your answer is no, this is my first time participating on these events. Press 2 if your answer is yes, I have participated on one or a couple previously. And press 3 if your answer is yes, I've participated on several events. All right, thank you. And then let's go ahead and go to another live caller. We have Rachel for Melissa Sager. Rachel, you are live. Go ahead and ask your question.
Hi there. Thanks for taking my question. I'm just a little confused because there seems to be different requirements for different, I guess, industries. Like when I go out to eat at a restaurant, I have to wear a mask if I'm not at my table, but I can go next door into a retail store and I don't have to wear a mask. And there's places, the restaurants have told me, like, we have to clean our keypads before you can, punch in your PIN or whatever. But I go to the post office and that doesn't have to happen, or King Soopers. I don't understand all the discrepancies. Also, like at our church, we can't have children's church because that's not allowed. But I know that I'm getting ready to put my 4-year-old grandson in camp next week, and they can have up to 10 indoors at camp. So I don't understand all the discrepancies, and if we're supposed to be so worried about catching it and being safe, why it's different everywhere.
Yeah, thank you for the question, and it's a really fantastic one because it gives me a chance to touch on a number of things. First, just overall, a lot of this is going to depend on the facility itself that you're visiting. So the statewide order has given a bit of flexibility, so it doesn't say all keypads have to be wiped off after every use. It says clean those high-touch surfaces as frequently as possible. And so some of that ownership of cleaning is on the business itself. It's going to depend on the entity. That's true for masks as well. So some establishments are going to require you to wear that mask. As Dr. Douglas touched on earlier, we strongly urge folks to wear those masks, but there is this flexibility built into the order so that it's not strictly required. So it's going to depend on the establishment that you're in for some of those things. With that, the Tri-County Health Department is working very closely with our businesses and encourage all of our businesses to reach out to Tri-County. We have a business reopening task force specifically dedicated to working with businesses to ensure that our businesses are adhering to these requirements to the greatest extent possible and making sure that they have the resources to do so. So if you have a question about your business and what you can be doing to be safer and what the recommendations are, you can reach out to that task force at COVID Business Recovery at tchd.org, and we'd be happy to chat. I'll also mention quickly that you can report violations to our call center. That phone number is 303-220-9200. And then just very quickly, places of worship and childcare within that. New guidance is out on places of worship, so please check out the state's website on this new guidance and refer places of worship to us. We're doing our very best to educate folks as things change almost daily. And so please have your place of worship reach out to us for information on how children's church can happen.
Wonderful, thank you. We are now about halfway through our live town hall. So what do you want to ask the commissioners? Or if you have a question for Tri-County Health, you can press *3 on your phone, or you can send your question through the website at douglas.co.us/townhall. And remember, if your question isn't answered tonight, we invite you to go to douglas.co.us/citizenconnect to submit your question, and then we'll follow up with you directly. Let's go to our next live caller. We have Roz in Castle Rock for Commissioner Thomas. Roz, you are live. Go ahead and ask your question.
Hello. Thank you for taking my call. Hi, Commissioner Thomas. How are you doing?
Good. How are you?
Good, good. Just wondering, I was hoping to give my bride and groom some good news on the variance for venues. Do you have any idea when that might be received from the governor's office for us?
You know, Roz, we've been working with you and you've been such a good champion for your clients.
No, you've been great too.
Well, you know, you helped us put together that variance that business could still survive on and serve your public. And we've submitted a week ago to the state health department. And so I promise you that as soon as we get an answer, you are on my speed dial and I will call you and let you know. And we will put that information up on our website. So all of the other people who, like you, who are waiting to do great events will know exactly what's going to happen. That's the best we can do, is that we're waiting.
Do you think maybe in the next week or two? What are you thinking?
So Roz, we were told it would be about a week is what the state health department was thinking these would take. So they've been there a week. It'll be a week tomorrow, I believe. So keep your fingers crossed and pray.
All right, thank you,
Thank you, Roz.
Next, let's
Thank you,
go
Erica.
to an online question. Yes, of course. Annette, she would like to know how many people are allowed to attend church right now, and that is for you as well, Commissioner Thomas, if you would like to go ahead and answer Annette's question.
So I'm going to make sure that Melissa is listening to me. It's my understanding that it's based on the number of occupancy that the fire department says you can have in a church, and you can have up to 50%. And there's really good guidelines that family units can sit together, and there needs to be 6 feet between that family group to the next family group. And every other aisle is empty. And all the books, all the pens, everything need to be removed from those pews, and that the church needs to be cleaned carefully after each service. But I'm going to ask Melissa to weigh in to make sure that I got that one right. Thank you.
Commissioner Thomas, that was really perfect, and thank you for touching on those. I'll just add, churches do have a maximum capacity of 175 in Douglas County, and that was based on an earlier variance that the county obtained. We do anticipate updated guidance from the state on those events. The state is saying 100 folks. This may impact the number of folks within places of worship too. So be closely monitoring both of those, the county variances and the state update.
Perfect. Thank you so much. And again, if you're just joining us, or if you have a question on your mind, you can press *3 to get into the queue and ask your question live. Our next question is online. Annette has another question for you, Commissioner Thomas. Will there be Independence Day fireworks and events? Go ahead.
Oh, this is a great question. So the commissioners have had a lot of discussions about fireworks because they're a tradition. They are about what America is about. And you can see behind me, I've got flags. And all of us have flags in our office, just so you know. And there were some municipalities and other organizations that just felt they had to cancel their fireworks presentations this year for various reasons. And the commissioners got together and thought, you know what? Our citizens have demonstrated great resilience. They're healthy. They went into this being healthy. Our case numbers have just stayed so low. And we got our stakeholders together and said, how can we do fireworks for our citizens? And all our stakeholders came together and said, you know, I think it's possible to do some fireworks presentations. We're not going to have the usual big park events where everybody gets together for bouncy houses and things like that. But we are going to do fireworks in Highlands Ranch in the area of Mountain Vista High School. So there'll, again, be no events at Mountain Vista High School, but find a viewing place. Let's do block parties. Maybe restaurants can do some picnic packs for people. So let's just celebrate our freedom. There will be one in the Parker area. We're still buttoning down that location. And Commissioner Partridge, would you like to answer the question on what you're going to do for your fireworks in your district?
Sure. Thank you, Commissioner Thomas, and great job answering that because I think it was an exciting day when we made that decision, and it was a pretty quick decision for us. So in the southern part of the county, we are going to be working with Castle Rock. And just so you know, as we understand, Castle Rock will be having their 4th of July fireworks. I believe they will shoot them off from the quarry that is just west of town. So we've talked with Castle Rock about Friday, the 24th of July. That'll be the kind of the kickoff. It'll be a Friday evening at the tying in with what's called the hometown rodeo. So Castle Rock has been really generous to work with us, and it looks like they will be shooting them off at the same location. Again, that will be clarified fully as we're working with the fire chief, Norris Kroom from Castle Rock Fire, and work with Mayor Jason Gray to get that solidified.
Great, thank you so much. All right, we have another online question. This one's for Commissioner Partridge. It reads, if I have an idea for a possible variance request that I think is reasonable, how do I talk with the board about it? Go ahead.
Thank you. Thank you, Erica. Thank you for bringing that forward because we are hearing this every day. Today I heard about some of the long-term care facilities where the residents are saying, we would certainly like to have some more visitors. So that may be one of our new variances we approach with Tri-County and give them the option to whether they would be able to allow visitors or not. So if you have an idea, certainly you can connect with your Douglas County commissioners because the variances have to go through the county commissioners, and we submit those to Tri-County Health for their approval. And once we have that approval with Tri-County Health, we send it on to CEPHE. So if you would like to submit any idea, I'll give you how you can connect with us online. It is through douglas.co.us/citizen connect. That is Douglas with just one S, .co.us/citizen connect. Thank you, Erica.
All right, thank you, Commissioner. Let's go ahead and go to our second poll. We would like to make sure you stay informed about what's happening in Douglas County. So if you would like to continue receiving information from the county, please press 1 on your phone now. Let's go ahead to another live caller. We have Eric in Parker, a question for Melissa Sager. Eric, you are live. Go ahead and ask your question.
Yes.
Eric, can you hear us? Okay, go ahead.
Yes, I work with a dentist who provides mobile dentistry services to assisted living centers and long-term care services. And we're wondering when we might be able to have access to patients in those facilities to provide periodic dental services.
Thanks for the question, and I remember chatting about this previously with other dentists that provide this service in this way. So the guidance that we've been provided from the state is that it is going to depend on the facility and what protections they have in place. But the services can be provided so long as you're adhering to the guidance based on from the Department of the licensing department for your license. But these are really tough facilities to work within because they are so prone to outbreaks, and so there's these extra protections in place. We are talking about updated guidance with the state for these facilities, and we do know that they have several task forces working on both visitors in general to these facilities, and so I encourage you to keep an eye on the state and check back with us here at Tri-County for updates on that should anything change statewide guidance.
All right, wonderful. Thank you for that. And then again, if you have just joined the call, you can press *3, or if a question has come up, you can press *3 to ask anyone on the call your question, get live in the queue. And then we're having a lot of questions still come in about weddings and large events. So, Commissioner Thomas, if you could, can you please do another quick recap for those that are just now asking the same questions? We just seem to have a lot of interest in that. If you could go ahead, Commissioner.
Absolutely. So we know that there are a lot of people who are looking forward to weddings and other larger events over the summer. The county has submitted a variance that was approved by Tri-County Health, and some of the industry leaders worked with us on developing what they could do in order to have these great events in a safe fashion. Tri-County has already approved those requests, and they have been at the state health department for about a week. The state health department has told us they're hoping to get these variances turned around within a week. So we are hoping to get those any day. As soon as we get a variance approval from the state, they will be posted on the county website. And that again is Douglas with one S .co.us. And just click on the little COVID box, and that will bring you to a page where you can see the variances that have been approved. And again, what we're asking for is 175 people on an inside venue, 250 on an outside venue. And the industry has told us they can do this with distancing, with putting families at tables and keeping the tables apart, and doing all the things that Tri-County has asked them to get done. So right now we're in a holding pattern, waiting for the state health department, but hopefully it won't be much longer. So thank you for your patience. Thank you, Erica.
Thank you. And now we have an online question for Commissioner Partridge. And Rachel wants to know, will we still have the Douglas County Parade?
Great. Thank you, Rachel. And the Douglas County Fair Parade is actually an event put on by the Castle Rock Chamber of Commerce. We are working with the Chamber for a variance. The Chamber has stated they know there are a lot of challenges. One is because of the path that the parade usually takes, the route is going to be very difficult because of the construction downtown. So they have challenges looking at a new route, what that would look like. But no doubt there are many challenges because of the number of people that would line up on the streets. But hey, in Douglas County, we have that can-do attitude. So we're working very hard with the Chamber, and we'll be working very hard with Tri-County Health and CDPHE. And by the way, we have invited the Executive Director, Jill Ryan of CDPHE, to come down to a visit to Douglas County so that we can actually physically show her a lot of what we are doing here, share with her our data, and share with her our ideas. And she stated, you know what, Douglas County is one of the model counties on the Front Range. So she said she's working on her calendar to come down to have a visit for us so we can get more of these variances in. Thank you, Erica.
Thank you. And thank you also to Ms. Sager, Dr. Douglas, the Board of County Commissioners, all of you, everyone who's joining us on this call tonight. You've asked so many thoughtful questions, and we really appreciate you taking the time out of your evening to be with us. We have time for a few more questions before we wrap up. We are going to go to an online question from David. And he has a question. Do you have data on the number of COVID-19 infected and deaths in Douglas County? And Melissa Sager, if you could address that question, go ahead.
Yes, absolutely. So if you go to our website, cchd.org, and you can click on our COVID updates, we have a full data page that you can go through all the information specific to Douglas County, and it is updated daily. And so you can see that information right there on the website, both cases, deaths, In addition to that, you can find a lot of other information about what's happening in the county and across our 3 counties regarding a wide variety of information related to COVID. So I'd encourage you to check that out.
Thank you, Melissa. And we have another question for you. This is from Jennifer. She says, if the variance is approved for weddings, I have heard that there's no receptions or parties allowed at the venues. Is this true?
So under the current statewide guidance, wedding receptions are prohibited. Under the Douglas County variance that's being requested, it would allow those activities to occur up to 175 people indoors. I will mention that this looks a lot different than your traditional wedding reception that you're used to. There will be a lot of protections in place to control movement within these establishments, and folks are going to be asked to keep that 6-foot distance from anyone outside of their household. So while you could have a DJ and a dance floor, maybe you have a few dance floors throughout that's encouraged in small group dancing within your household so that that contact isn't occurring.
Thank you, Melissa. We have another question coming in online from Brendan for Commissioner Thomas. And Brendan wants to know, do you have an update on the status of the variance request that is regarding community pools?
The community pools right now are under the governor's Safer at Home and Vast Great Outdoors, which allows for 50% of capacity up to 50 people. And again, we are working on a variance that would allow more people in the pool. And we're just anxiously awaiting for that to come back from the state health department. It has been approved by Tri-County Health. And Erica, while I'm here, can I just mention some specific numbers? Somebody asked a couple of minutes ago about specific numbers. And since this started on March 5th, Douglas County has had a total of 825 people test positive for COVID. And to just put that in perspective, during that same period, Arapahoe County has had 4,607 cases. That's 5.5 times the number of cases we have had in Douglas County, even though their population is not quite twice what ours is. And just in the last week, we have actually, since the 1st of June, we've only had 4 hospitalizations in Douglas County with COVID. So our numbers really do continue to be low, and it reflects that we are the healthiest county in the state and the nation. And that's why the health department at the state has been more willing to give us variances because of the condition and the number of COVID cases we actually have. Thank you for that extra time, Erica.
Of course. All right, our next question is an online question from Lavanya, and she says, I own a tutoring service in Parker for kids from preschool to high school, and I would like to know how many students am I allowed to have in my center? If you could address that one, Melissa.
Absolutely. Thanks for the question. Currently, under the current order, you can have 10 people within one room. So you can host several groups of 10, so long as you don't exceed that 10-person limit. We do expect this updated guidance from the state tomorrow or Friday with the updated public health order that will likely touch on the requirements in this space. So I encourage you to keep an eye out and reach out to us if you have questions, because that's likely changing soon to increase those numbers.
Great, thank you so much. And we have another question for you, Melissa. This one's coming in online. And she says, I'm listening to the Tri-County Wednesday call right now. My mom lives in Denver County in assisted living, and I know that the assisted living places will be the last to relax restrictions decided upon by the state. So do you know what the state is planning for retirement community guidelines for relaxing restrictions? I'm concerned about the mental health For all the residents and the lack of their socialization, does Denver have a group like Tri-County that would be able to do a question and answer like you guys do?
Thanks for the question, and this is something that has come up so often for us, and we've heard so many heartbreaking stories about the real impact of this isolation with folks living in these facilities. And so this is a very serious issue for us here at Tri-County. We are communicating with the state daily. We did receive draft guidance from the state that we provided feedback on. We understand that the state is working through these documents within a task force to really develop fulsome guidelines that we can put in place to allow visitation to occur. So we really hope to see that soon. Keep checking back. We do understand the urgency of the issue, and so thank you for the question. And the Q&A session, I've jotted that down. I will take that back to our team as far as holding a Q&A session on this issue specifically. Thank you for that.
Okay, and just a final reminder, since we are coming to the end, if your question was not answered tonight, we really encourage you to visit douglas.co.us/citizenconnect. You can submit your question and we will respond. Be sure to join us again next week on Wednesday, June 24th for additional updates on our economic reopening. Now, before we conclude our live town hall, we'd like to give your Douglas County Commissioners a few moments for their final comments. So, Commissioner Partridge, let's hear from you first. Go ahead.
Great. Erica, thank you so much for hosting. Thank you for all the online listeners and questions. And also thank you, Dr. Douglas, Ms. Sager, and David Ray for joining us. We really appreciate it from the commissioners, and I know our listening audience does too. So we continue to thank you, the residents, the businesses, and the employees who have been very diligent to help us out moving forward the variances. You've been very diligent to take care of yourself, take care of the others, and really make this the team effort it is to get Douglas County back to a more normal working and recreational level. So you are just wonderful. We're blessed to be able to serve you, and we thank you for the opportunity to help you.
Wonderful. Thank you, Commissioner. And now let's hear from Laura Thomas. Go ahead.
Thank you, Erica. I'd like to echo what Commissioner Partridge just said, thanking all of you for listening in every week. And I'm sure that Commissioner Layden wishes he could be here to do the same. He really enjoys being a part of these discussions and connecting with his citizens. Let's just hope that the State Health Department releases our variances this week. And so we'll have less questions next week because you will have the answers that you are so anxiously waiting for. So continue to wash your hands, be safe, and we'll see you all next week. God bless all of you. Bye-bye.
Thank you, Commissioner Thomas. And on behalf of Douglas County and the Tri-County Health Department, thank you for sharing your time with us, and we hope you'll join us again for future town halls. Be well, be blessed, and good night.